All right, welcome to episode 2. We're going to talk about the thigh. So we're going to start with the posterior thigh. The first muscle is going to be the biceps femoris. For the proximal attachment of the long head, it'll be the ischial tuberosity. And for the proximal attachment of the short head, it'll be the lateral line of the linea aspera. For the distal attachment, it'll be the lateral side of fibula. And for the innervation for the long head, it's going to be the tibial nerve, L5S2. And for the short head, it'll be the common fibular nerve, also L5S2. For the arterial blood supply, it's going to be the deep femoral artery, the medial femoral circumflex artery, the inferior gluteal artery, and the genicular arteries. The action is going to be flex the knee, rotate the knee, and extend the thigh. Next is the semitendinosus. For the proximal attachment, it'll be the ischial tuberosity. For the distal attachment, it'll be the pes anserine. For the innervation, it's going to be the tibial nerve, L5S2. For the arterial blood supply, it'll be deep femoral artery, medial femoral circumflex artery, inferior gluteal artery, and genicular arteries. The action is going to be extend the thigh, flex the leg, and medially rotate when knee is flexed. The last one for the posterior thigh is going to be the semimembranosus. The proximal attachment is going to be the ischial tuberosity. The distal attachment is going to be the medial surface of the tibia. The innervation will be the tibial nerve, L5S2. And then the arterial blood supply will be the deep femoral artery and the inferior gluteal artery. The action is going to be extend the thigh, flex the leg, and medially rotate when the knee is flexed. Moving on to the anterior thigh, we have our vastus lateralis. For the proximal attachment, it'll be the greater trochanter and the lateral line of linea aspera. For distal attachments, it's going to be quad tendon, tibia, and patella retinaculum. The innervation will be the femoral nerve, L2, L4. And for the blood, it'll be descending branch of lateral circumflex femoral artery. For the action, it's going to be extend the leg at the knee. Next, we have our vastus medialis. For our proximal attachment, it'll be the intertrochanteric line and the medial lip of the linea aspera. For distal attachment, it's going to be the quad tendon, tibia, and patella retinaculum. The innervation is going to be nerve to vastus medialis, L2, L4. And then for arterial blood supply, it's going to be femoral artery, deep femoral artery, and descending genicular arteries. The action will be extend the leg at the knee joint. Next is the vastus intermedius. The proximal attachment of the vastus intermedius is the anterior and lateral surface of the shaft of the femur. The distal attachment is the quad tendon, tibia, and patella retinaculum. The innervation is going to be the femoral nerve, L2, L4, and the arterial blood supply will be the femoral artery, the deep femoral artery, descending genicular artery, and then the action is going to be extend leg at knee joint. Next, we have our rectus femoris. For our proximal attachment of the straight head, it's going to be the AIIS, and for the reflected head, it'll be the ilium. For the distal attachment, it'll be the quad tendon, tibia, and patella retinaculum. For the innervation, it'll be the femoral nerve, L2, L4. And for the blood supply, it'll be the descending branch of the lateral circumflex femoral artery. Next, we have our sartorius. Before that, the action of the rectus femoris is extend leg at knee, assist iliopsoas to flex the hip, and stabilize the hip joint. Now moving on to our sartorius. The proximal attachment will be the ASIS. The distal attachment will be the pes anserine. The innervation will be the femoral nerve, L2, L4. the blood supply, will be your deep femoral artery, superior circumflex iliac artery, descending genicular artery, lateral circumflex femoral artery, and branches of the femoral artery. The action will be flex, abduct, laterally rotate the thigh at the hip joint, flex at the knee joint, and medially rotate the leg when knee is flexed. And our last one for our anterior thigh is our articulus genu. The proximal attachment will be the distal anterior femur. The distal attachment will be our suprapatella bursa and our synovial membrane. The innervation is going to be the femoral nerve, L2, L4, and the blood supply will be the descending branch of the lateral circumflex femoral artery. The action is that it pulls synovial membrane superiorly during extension of leg at the knee, preventing folds of membrane from being compressed between the femur and the patella. Next, we have our medial thigh. We're going to start with the adductor longus. The proximal attachment of the adductor longus is the body of the pubis inferior to pubic crest. The distal attachment is the medial third of the linea aspera. The innervation is the obturator nerve, the anterior branch. The blood supply is the profunda femoris artery, and the action is to adduct the thigh. Next, we have our adductor brevis. The proximal attachment is the body and inferior ramus of the pubis. The distal attachment is the pectineal line and proximal part of the linea aspera of the femur. The innervation is going to be the obturator nerve, the anterior branch, L2, L4. The blood supply will be your profunda femoris artery, and your action will be to adduct the thigh and to some extent flex the thigh. Next is our adductor magnus. So the adductor magnus has two parts. It has the adductor part and the hamstring part. So the proximal attachment of the adductor part is the inferior ramus of pubis and ramus of ischium. For the proximal attachment of the hamstring part, it's the ischial tuberosity. For the distal attachment of the adductor part, it is the gluteal tuberosity, the linea aspera, and the medial supracondylar line. The distal attachment for the hamstring portion is the adductor tubercle. The innervation for the adductor portion is the obturator nerve posterior branches, L2, L4. The innervation for the hamstring portion is the tibial nerve, L4. The blood supply is going to be the profunda femoris artery, the femoral artery, the popliteal artery, and the genicular arteries. The action is to adduct the thigh, and then the adductor portion flexes the thigh, and the hamstring portion extends the thigh. Next is our gracilis. The proximal attachment of the gracilis is the body of the inferior ramus of pubis. The distal attachment will be our pes anserine. The innervation will be our obturator nerve, L2, L3. The blood supply will be our profunda femoris artery and our obturator artery. The action will be adduct the thigh, flex the knee, rotate the leg medially when the knee is flexed. Next, we have our obturator externus. The proximal attachment will be the margins of the obturator foramen and the external obturator membrane. The distal attachment will be our trochanteric fossa of the femur. The innervation will be the obturator nerve, L3, L4, and the blood supply will be our obturator artery, the anterior branches. The action is external rotation of the thigh and hip and stabilizes the head of the femur in the acetabulum. And the last one for the medial thigh is going to be our pectineus. The proximal attachment is the superior ramus of the pubis at the pectineal line, and the distal attachment is the pectineal line of the femur inferior to the lesser trochanter. The innervation is going to be our femoral nerve, L2, L3, and our obturator nerve, L2, L4. The blood supply is going to be our obturator artery, the anterior branch, and the action is to adduct and flex the thigh and assist in medial rotation of the thigh. And that's going to be it for the thigh.